Hi everyone, this is Dr. Shah. I'm a GP in NHS England and Medical Director of Dr. M. Shah Wellness and Aesthetics Clinic. Today, this video, I'm going to show you the correct way of diluting your Boccoture and Botox because the dilution is exactly the same for both the products. So I've got some syringes, some insulin syringes, normal saline and some wipes. First and foremost thing is making sure you use antiseptic wipes and clean the surface. Next important point is releasing the vacuum, and that I will do by inserting a needle into my, as you can see here, I've released the vacuum. This will prevent any bubbling and wastage of the product. After doing that, I secure my needle and I take normal saline. For that, I use bacteriostatic normal saline, which is better and also less painful for the patients. So for the 50 units of Boccoture, I'm using 1.25 ml of normal saline. I'm going to insert the needle 90 degrees and slowly release the normal saline into the ampule, making sure I'm not making any bubbles. After adding the dilution, I mix it well, and that I do by making a figure of 8, as you can see in the video. It's a good mixing technique and also it prevents any bubbles. I roll it and then make sure it's all mixed. Once I'm happy with the mixing, I take the lids off and start filling my syringes. I use two kinds of insulin syringes, 0.5 ml and 1 ml. Let's talk how many units we get per syringe. For a syringe of 0.5 ml, you get 20 units of Boccoture or Botox per syringe, and that means you get 2 units per 0.05 ml. For a 1 ml syringe, you get total of 40 units of Boccoture per syringe, and you get 4 units of Boccoture every 0.1 ml. Now, planning is everything. So every patient have their individual plan, and I make sure I make all my products ready before the appointment. After using the product, it's very important to dispose all the sharps and needles in a correct sharps bin. Also explaining detailed aftercare to your clients so they know what to expect. I hope you enjoyed this video.